and really this is one of the reasons for which you are again late today. But nonetheless, here we are for another update. Like we did indicate a couple of days ago, that we will be giving you updates on this situation every single day until otherwise instructed. So we'll be doing it every day. All right. Now, this briefing that I'm giving you is organized together with a task team that it is part of the National Emergency Response Committee that was created by the head of state on 28th of February. And that is at national level, and this is technical. And for that reason, it is why Dr. Amoth, who is the Acting Director, Health Services, is here with me. But there are other stakeholders who also ought to be here, but because of many other engagement as far as this issue is concerned, they could not be here this evening with us. But nonetheless, this is something that we cannot do on our own as a government. It requires collaboration of many stakeholders, because this country belongs to all of us, not just government, not just the media, but all of us together. And therefore, even as we're talking about the whole of government approach to dealing with this situation, we must also talk about the whole of country approach. And therefore, it is your responsibility to be able to rally our people in terms of combating this situation. And therefore, the briefing this evening is as follows. We're all aware about this coronavirus situation, which has been spreading across the globe. And as a country, we reported our case on the 13th of this month. And we have heightened our efforts to ensure that the situation does not spread beyond what we have. But as of today, we still have 3 cases of confirmed coronavirus patients. But in totality, those that are admitted are 20. Out of the 20, like I did indicate, 3 are confirmed, other 3 are suspected, and we have another 14 that are under quarantine awaiting results. So the second set of 3 that are suspected are also awaiting results. The other 14 are also awaiting results. Yesterday we did indicate a figure of 22, but according to medical protocol, we cannot keep anyone in hospital who has not shown any, the test results are not positive. So we keep on testing them, and those who have shown that they don't have the virus, then we let them go. But the first 3 that we are isolating beyond those that are positive cases is because the 3 met the case criteria. And the case criteria, like we have also indicated regularly, that there is a threshold that you must meet in order for you to be isolated. Now, we did talk about dry cough, we talk about difficulty in breathing, we talk about fever, we talk about malaise. So those 3 met the case criteria, and that is the reason for which they are isolated, waiting for the test results. As a country and as a people, we have continued to strengthen our measures, and we have put effort in place to ensure that the situation does not escalate beyond what it is today. And the National Emergency Response Committee is coordinating together with other counties and other stakeholders to ensure that we do not leave anything to chance. And therefore, we have consistently continued to enhance our capacity at various levels. The first level that we're concerned about seriously is that if at all this situation were to sprout seriously at the community level, and we're not ready there, then we'll have a big issue. And therefore, we have consistently worked to enhance county capacity. And currently, we can proudly say that we have 35 counties that have confirmed that they have necessary quarantine and isolation facility to be able to deal or handle COVID-19 cases. They have testing kits, and necessary supplies have also been available to them in order to be able to carry out the necessary management of if cases would have come up within the counties. These additional facilities within the counties are to ensure the county is able to handle the COVID-19 related cases in the event the county reports more cases, like I did mention, at the community level. We are currently undertaking training of trainers, and this is being conducted in all the 47 counties. This is aimed at ensuring that all counties have capacity to test and manage the disease. We are also conducting training of all health care workers at all health facilities, including, of course, Mbagathi District Hospital. Indeed, you recall that these are our first line of defense, and therefore we must be able not only to train them, but also to equip them well so that we can give them the confidence to be able to handle these cases as they come. In order to be able to empower our people in as far as information is concerned, because this is not necessarily a medical situation, as it were. This is more of a communication situation. And therefore, we must be able to provide information to our people in order not only to educate them and give them knowledge, but also to enhance awareness at the community level. And to do this, like was mentioned yesterday, we have call centers that has been established at the number that was given yesterday. I'll give it again. It's 719 and *719#. On that call center, if you call it, you'll be able to provide it with information in as far as COVID-19 or coronavirus is concerned. We're also looking at enhancing that capacity, and we're working very closely with the Kenya Red Cross to see how best we can be able to use their call center facility that has been tested, that many people know about, and they also know the number, which is 1199. But as soon as this system is up and running, we'll be able to give you more details in how we are going to incorporate this additional facility from Red Cross together with what is already in place. That is 719 *719#. Those two will be able to, in our view, not be sufficient, but they'll be able to help a lot in terms of providing our people with the necessary information as far as COVID is concerned. We'll not end there. We're also going to the community level to be able to provide them, one-on-one training, one-on-one engagement with them. We are aware that social gatherings have also been suspended, and therefore we're going to break into small teams as we go down to the community level so that we can be able to engage in community training. We also enhance our testing capacity. A lot of people have been asking whether we have the capacity to be able to carry out these tests here. This has been said severally, but still we have to keep talking about it, because this is what is the truth. That previously you're all aware that we are taking these tests, specimens out of the country. Today, we are doing all these tests locally, but we're also expanding beyond doing these tests in Nairobi. Like was mentioned yesterday, we have now expanded to other KEMRI satellite centers out of Nairobi. These centers are in Busia, Kisumu, Kericho, and Kilifi, together with the 2 centers that we have here. So we are expanding that capacity to ensure that if there are specimens taken from a patient or a suspect case in Bungoma, the specimen do not have to be brought to Nairobi, and therefore that shortens transshipment time, but also when the test results can be given back to the patient or to the suspected case. The other one is about our screening. We have 34 points of entry in this country. That includes airport, seaport, and land entry points. Now, all these points, we are undertaking screening. So, if you go to the airport today, you will be screened. You will find people being screened. If you go to Malaba, if you go to Busia, if you go to Namanga, passing through there, you will be screened. But these are very important activities to undertake because the cases that we have are all imported cases. And therefore, we must be able to enhance our screening capacity. We must be able to be very vigilant to ensure that these cases remain at whatever that level they are. But we must also, be cognizant of the fact that I know the question may be asked, then if we are that vigilant at the point of entry, then how come these cases manage to sneak? The doctor is here, and he'll probably tell you that there are cases during which you can be able to be screened, but because you're not exhibiting the symptoms, there's a possibility that you can be able to pass under the radar and not be seen. And this is the case that happened with these 3 cases. Just to give you a bit more information about those 3 cases, because I know you are interested. The first case is the one that we all are aware about. That is case number 1. We know that case. The other 2 cases are those who are in close contact with case number 1. So that makes them 3. But we are in the process of doing contact tracing of all the others. It is a delicate process. It is not very easy, but nonetheless, our surveillance teams are in the process of doing that, and we are confident because the other 22 are also gotten out of that contact tracing. So that is what we are doing, and therefore, at all our points of entry, we are enhancing and ensuring that we are vigilant, that nobody can actually pass under the radar. Indeed, today, I know there are concerns regarding what happened at Mbagathi today. I know some things are circulating in the social media, but we are enhancing as a people, not as a government, but as a people of Kenya, our capacity to be able to train all our health workers, because indeed they are the ones who are our first line, and we must be able to take care of them, not only in terms of training, but also in terms of equipping them so that we can give them the confidence that they are taken care of. I know we are all reading, they are reading as well what happened in other parts of the world, and therefore as a country we must be able to learn from the experience of others, and therefore to us they are very, very critical for us. And therefore, the case that happened in Mbagathi has been sorted out. They have been given equipment. They're going to be trained. However, I must also say this, that Mbagathi, what happened there was not part of activities at the isolation center. This is normal Mbagathi District Hospital personnel. But because some of our people who go to be tested, want to be checked, they are passed through the same gate. And therefore, they had every reason to be concerned about their health. And as a government and as a people, we therefore, we must be sensitive enough. We understood their case, and they have been attended to appropriately, and necessary training is going to be offered from tomorrow, but the equipment has been taken there, and the director can be able to confirm that. In terms of isolation and quarantine facility, of course, this was again highlighted yesterday by the head of state, but just to reiterate that we have what we know as Kenyatta Mbagathi, now Kenyatta University Teaching, Referral and Research and Referral Hospital, that is going to be used also not only as isolation, but also as isolation and treating hospital. The others in the counties will be isolation and quarantine and isolation. But Kenyatta University Teaching, Referral and Research Hospital will be beyond isolation. It will also be training. And therefore, our isolation and quarantine facility has increased. Like I did mention, 35 counties have also established quarantine and isolation facilities. So we are actually, as a country, in a very good place in as far as management of cases that may arise is concerned. But indeed, we may be talking about health facilities, training personnel that work in the health facilities. But there are a large community of stakeholders out here. And these are border operators, taxi operators, policemen, prison warders. All of them interact with a huge number of people every single day. Now, to those ones, training has also started. Today, the training of matatu operators took place here in Nairobi and is going to be carried out countrywide. There was training at a railway station today that was carried out, and the whole idea is to empower them so that they can also be able to know how to protect not only themselves, but also their clients. So what are the preventive measures? Of course, like I did mention, this is more of a prevention war. It is not a medical war, because even if somebody were to go to hospital, and I'm not a doctor, the doctor is here, but he tells you that he'll be treating symptoms. So he'll not be treating the disease. And therefore, the best way to treat this disease is prevention. And that explains why it is important in as far as communication is concerned, that we must tell our people how they can be able, at that community level, at individual level, to take care of themselves, to ensure that they practice safe food hygiene, hand washing, and ensuring they use sanitizers. I am aware that there are places that you may not get sanitizers. But what do we do then? If you cannot get sanitizer, then of course you can use soap and water. That is effective, that has been used other parts of the world, and they have worked. So sanitizers should not be reason enough for one not to practice safe hand hygiene. So if you are in far-flung areas where you cannot get sanitizers, please use soap and water. The idea of whether ash works, and I'm saying this with a lot of understanding and a lot of sensitivity about knowing our communities. But do not go that direction, kindly. Use clean water and soap that works when you do not have sanitizers. Indeed, there have been concerns regarding the availability of water in public places. And the national government is working very closely with the county government to ensure that county governments provide water and sanitizers in public places. You realize that even matatus are concerned about this, but also saying that there's a contribution that you can make also as an individual. If you're an owner of a matatu, it doesn't cost you so much to spend a little bit of your money, because these are your clients, to buy sanitizer for your matatu. So this is a collaborative effort, not only between government and the stakeholders that I will mention, but it's between government and all of us as a people, that we must be able to ask ourselves at my own individual level, as a Kenyan, what must I do, not only to protect myself, but to protect my family, my next door neighbor, and the others. If all of us are able to do that, I trust and believe that we are going to contain the spread of this coronavirus. The other measures you can be able to take is to avoid close contact with the people suffering from acute respiratory infections. If somebody has difficulty in breathing, he is likely to have such infection. So please do not be in close contact with that person. What has been recommended is keep at least 1 meter from that person. We yesterday did mention that it is important to also exercise safe social distance. And for those who are keen, if you looked at the picture yesterday at Harambee building, you could see that actually that was being exercised yesterday. Go back, for those who were not keen enough to check at the picture, you'll see that the head of state was there, only 2 people behind and 2 people maybe at the back. That was a way to demonstrate the importance of keeping that social distance, 2 meters, at least a meter between one person and another. But it's so important that you're not just thinking about washing your hands, but there are many things that we touch. The door handles. I'm persuaded to believe that all of us come from some estate somewhere, and those estates have got gates. And within those estates, there could be 200, 300 people in that estate, and all of us enter through that one single gate. It's opened when you're going in and when going, but perhaps the person who is opening it is the watchman or the guard there. But how many of us think that it is important to have water there? That even sanitizer there, that we can ask this person that anytime somebody comes, please, try to clean it. When somebody leaves, try to clean it. We do not, but it is important that we start thinking that way right now. Because one person, and like doctors would say that this is a cluster thing, that one person would perhaps infect 2, 3, 4 people without knowing, of course, innocently. But science, a concept would state that any of us being Africans, one person is linked to 10 other people because of our social behavior. So if one person is linked to 10 other people and one person infects 10 unknowingly, the other 10 would infect another 10. And before you know it, you have a snowballing kind of situation that keeps on spreading. And therefore, even as you go home, please, as you enter into your estates, if you can agree as a community there to buy sanitizer or hand washing, just put it there and ask this soldier, and they're called soldiers, don't they, to be able to clean as somebody comes in and somebody goes out. It will help us in a lot, to be able to do that. We're also looking, it was discussed yesterday, at the possibility of ensuring that all our choke points, and choke point here we're talking about bus terminals, where all of us meet when you want to go home in the evening or coming to work in the morning, that at night, during those you can call, the silent hours, that you can have them being sprayed and fumigated, so that when we come in the morning to work or to other places, they are fumigated, and again it goes on in the evening. But it requires a participation from all of us. I did mention about keeping water in public places so that we can be able to wash our hands, but it also calls for responsibility among us ourselves, that we don't put that water container one evening and the next morning it is not there. So again, that behoves you, members of the press, to be able to educate our people. It is important for all of us to be able to right now exercise the highest level of discipline, the highest level of nationalism, because without us coming together, it might be a bit difficult to be able to contain this. Of course, anyone who is showing signs, I think just logical and realistic that he reports to the nearest health facility, but in case for one reason or another cannot be able to do that, we have given a number to be able to call 719 star, but that is just for information, but 71 will give you an operator who will be able to assist you. This is in addition to other lines we have always been giving. In case one is showing signs, then of course your advice that as you wait to be taken to isolation will be assisted by health workers that are in all the counties and are waiting to assist. Please isolate yourself as you wait to be assisted. Do self-isolation to protect yourself, so your family and the others around you as you wait for help to come. We are also looking at the best way to be able to improve and make that help to be efficient. And Red Cross has volunteered to give out 20 ambulances that was talked about yesterday that will be helping. I know that may not be enough, but that's from Red Cross. There are others who have also offered to help. And therefore, there is a lot of help that is coming from several sectors and agencies that would help in terms of combating this disease. Yesterday, the head of state did pronounce and even urge mobile money operators to look into ways on how they can be able to ensure that they reduce their charges. And we are glad to note that some of them have already heeded to that call. And as you're aware, Safaricom has already issued statements regarding how they are going to charge mobile money transactions. Other operators are also thinking of doing the same, and within the next 2 or 3 days, we're going to see a completely different field. And this is to ensure that we do not necessarily, transmit through physical exchange of money, right? So as a government and as a people, we appreciate the support that we have been given by many other stakeholders. And I did mention that we cannot do this on our own. We need everyone else to be accounted, to be at the dinner table to help us combat this. We have worked closely with WHO, and you're all aware from this very word go. We have worked with UNAID. They have been here. We have worked with UNICEF. We have worked with AMREF, Red Cross. The county government have been extremely seized onto this matter. Because when something happens at the ground, they're the first people that will be affected. And therefore, I just also want to take this opportunity to thank them for the support they have been rendering in as far as this campaign is concerned. But I also want to thank members of the press, really, for the assistance that you've been giving us as a country. This is your country. And I'm saying jokingly that, you see, you have to be able to also contribute in this. Why? Because Kenyans, they are your clients. And you must be able to take care of your clients. Because when they are not there, then you don't have a client. Right? So all that you must be able to do, and we're asking you that what you must do is consistently keep on giving Kenyans accurate information. Not any other information. There have been many, other channels through which information has been, peddled around and across. But we are saying, and appealing to you, that if you see any information that you doubt, please, you have our contacts. Please call us any time of the day, 24/7. We will be able to clarify whether it is true or not. It doesn't help to provide information that is out there that is not accurate. So we cannot be able to combat this by giving out inaccurate information. And therefore, it is a responsibility of each and every one of us to ensure that whatever we forward for those who are in our networks is information that has been verified. That will help us in terms of combating this COVID situation. I wish to end there and to invite questions. Yes.
My name is Kenyan Radio Nation NTV. Two questions. One, you have enumerated on the 3 other suspected cases. And is it a confirmation from you that these are not people who were in the country, but people who have come into the country recently? And number 2, does the government have enough kits to test this COVID-19? This is with regards to some questions that have been raised, that there is a probability that the kits that we have are not enough. Thank you.
Can we take another one? Yeah? And so they feel like they are restrained and nothing accounts for the number of testing and all that. So how many people exactly are there? Because it feels like the numbers keep changing, people still exaggerate, but I want to confirm.
Okay.
Can you take one more?
Yep, fine.
Is about the number of commuters in the Likoni Valley, over 3,000 commuters. What are the measures that are put in place to ensure that the spread is not experienced there? And also, you talk about 25 counties having the quarantine for the testing kits. What happens to the rest of the counties?
You can take this.
Very well. I will take a few, but I'll ask, of course, certainly the Director, Health Services, to also take some. Now, the first one is with regards to the three suspected cases, whether they are all import cases or not. Of course, the first one, all know, is an import case. The second one is also an import case. The third case is not an import case. So that is the information that is there. And that is the truth about that. Enough kit in the country from national government, the Director we have enough kit in the country, and nobody should panic. We have sufficient kits to be able to test cases as they come. But we must also be able to do this, to tell our people that you do not need to go to, want to be tested simply because you are coughing. Because cases will come up. You're coughing and then you go for testing. No. Because you must meet what? The case definition criteria. So if you are sneezing only, there is no point of doing what? Running for testing. And therefore, the test kits that we have are sufficient, but you cannot use them wantonly. You must use them in accordance with the laid down definitions that determine who must be tested using the kit. But of course, the Director will also elaborate further. Now, the idea that people are being kept at Mbagathi without necessarily being told about their situation, and again, I leave that to the Director to be able to address. However, regarding the Likoni issue, and of course we did mention yesterday that we understand that there are situations where I have got a large number of people concentrating together. Those areas of activities and situations were suspended. This does not mean that we suspend the ferry services or the ferry service at Likoni. What that means is that we must be ready to accept some level of inconvenience, and therefore as they cross, then the number must be reduced. And therefore there will be a bit of delay, but that's the sacrifice that we must make as a people in order to defend not only myself, but to defend the country as a whole. Because a country with no people is no longer a country.